EMS providers are the first responders. They're the ones who bring us very critically ill or critically injured patients. They see the patients in oftentimes dangerous or unsafe situations. We recognize the critical role, the vital role that they play, and we treat them as part of our ER team.
The importance of the EMS as part of the care team cannot be stressed enough. They are the first to see the patient, and the interventions they take in the field is extremely important in the outcome of the patient.
Our first responders are truly the first member of the team. They are the ones that identify the injured patients, they triage the injured patients, and they appropriately bring them to trauma centers.
Brookhaven has a very busy emergency department. We see over 70,000 patients a year. That relates to 2.4 ambulances per hour, 24 hours a day, 7 days a week. That keeps our EMS providers quite active, and we're very thankful for them being able to respond to those emergencies and to help support our community and support our hospital.
The EMS pledge means a whole lot to me. It represents a commitment that I personally have as an ER physician here to treat EMS personnel with the utmost respect and to hold ourselves accountable to them in providing such great care to our patients here in the community.
Our pledge to EMS is a promise to be attentive, responsive, and customer accountable.
And the reason we need a pledge is to be able to support the EMS community who brings us those patients every day. It's critical for our organization to demonstrate that on a daily basis because our EMS providers have a choice of where to take their patients. We want them to feel welcomed, we want them to feel professional, and we want them to be supported when they encounter Brookhaven.
We have put procedures in place to improve interaction with the EMS crew. We have also provided our nurses with the communicators that will work with our wireless network so that the nurses can respond anywhere in the ER to the radio call.
Taking their calls quickly to ensure that our highly trained teams are available when they come to the emergency room. This way the EMS can go back out in the field with whatever they need to do their job all over again.
We will maintain a dedicated area for the crew to get refreshments, including healthy choices. We will clean their equipment that they leave behind, as well as for those agencies that are outside our outlying catchment areas, we will deliver those equipment in a timely manner.
This is a program that is organizational wide. Doesn't matter what department you work in. It's not just the emergency department. It's security, it's environmental support services, it's the clinical areas, and it's to understand and to appreciate the work that gets done. This is about our entire organization supporting EMS. So every department in our hospital has gone through extensive training on the pledge to be able to recognize the efforts of these volunteers.
We think of the EMS as part of the team and they're as professional as any of our doctors, nurses, and technicians at the hospital.
We need to treat the EMS workers as part of the emergency staff, as part of our hospital family. We understand that EMS providers have alternative choices, but with our new EMS pledge, we're going to prove to them our commitment to excellence and providing excellent outcomes for both them and their patients.
In combination between the new facilities we've constructed here and the general staff awareness in the emergency department, it is my hope that our EMS colleagues in the neighborhood would find Brookhaven as their choice facility to bring patients here, knowing that we've committed ourselves to providing the best care possible to their patients.
We're extremely thankful for our EMS providers in their support of this community and the hospital.